Robert Matiru is Director of Programs at Unitaid, which is a global health agency. He's also co-leading the O2 Task Force for ACT Accelerator, which supports the development and equitable distribution of tests, treatments and vaccines for COVID-19. He joins us from Geneva. Sir, thank you so much for joining us here on Al Jazeera. Obviously, the lack of oxygen is affecting many parts of the world, could end up affecting many more. I'd just like to start with India with you, because it does seem that India does produce enough oxygen. So why are we seeing the shortages that we obviously are seeing if social media and the people that we have been speaking to in India are anything to go by?
If we're speaking about India, I think there's two major factors here. India does have the capacity to produce sufficient quantities of oxygen, but two things are very challenging. One is the degree of planning for surge capacity that is needed. Clearly, in this case, the plans that have been put in place did not anticipate a rate and scale of COVID surge as has been seen in India, unfortunately. And secondly, where the surges are happening means that it can be logistically challenging to get oxygen from where it might exist in quantity, for example, industrial production facilities, convert that to medical grade oxygen and then get it transported simply to the states that are facing the highest surges. So effective planning for oxygen surges is so crucial that didn't appear to have happened in this case. And obviously the logistics are super challenging when the surges are happening in such a large country on such a large scale.
Some things are being done now. So, for example, industries have been ordered by the government not to use oxygen, so that can be liquid oxygen that can be diverted. There's also now an input from the international community when it comes to liquid oxygen, tankers, concentrators, ventilators. How difficult is it to get the stuff where it needs to go, though?
Again, it depends on the country. India is a vast country of vast geographical size. So you've seen, the need to transport bulk liquid oxygen in ISO containers has been in trucks, on trains, because trains appear to be the fastest way to get this bulk oxygen from one side of the country to the other. Traveling in trucks on long roads, sometimes in disrepair, can be really challenging. We're talking about bulk oxygen. Shipping in oxygen via other means, for example, transporting cylinders. Again, these cylinders have to be transported carefully. They are high-pressure containers of oxygen. Hundreds or thousands of them can be transported, but you need effective transport systems, whether it's trains or even more slowly trucks. That's a challenge, especially for vast and big countries.
We can see how people, obviously gripped by desperation, are going online, trying to get oxygen and are obviously paying much more than oxygen or the drugs would normally cost. What are some of the side effects of the black market that seems to be emerging?
Well, a major and obvious side effect is it's pushing people in poverty even further into poverty. Already low-income families are paying exorbitant amounts of money to obtain a small cylinder of oxygen for their loved ones who are struggling with severe or critical COVID. So that's a major side effect for sure. This oxygen is unregulated. It may not be of the concentration or purity it needs to be. Medical grade oxygen needs to be at 82% or more. We don't know if the tanks that are being sold on the black market have that concentration, whether they're properly fitted, whether they have the right accessories. It can be unsafe as well. So that's another side effect. It's unsafe. And lastly, it is very challenging for countries already, and not just talking India, countries that are low income, even lower on the development scale, facing this type of level of surge is going to be putting whole families and livelihoods in a very precarious position because of this situation.
I was going to ask you about that, because I think, India could be accused, I guess, of a lack of forward planning and of maybe supporting the health infrastructure before the pandemic as well. But it does, generally speaking, have the infrastructure there. But what about the countries that don't, especially because we are seeing this, this wave already potentially worry countries like Pakistan. We'll be talking about Nepal in a few minutes, Bangladesh. We see more waves in Latin America. What could the impact be in countries that don't have India's infrastructure?
the impact could be even more devastating. I mean, the size and scale of the crisis in India is what is so alarming and tragic. But if these type of surges were to be seen in neighboring Pakistan, or the parts anyway bordering India, in Nepal, in Bangladesh, further south as you go into South Asia, in the Philippines or Thailand, it could be really devastating. And therefore, it's really critical that governments in these countries, but also international partners, come together now to put in effective surge capacity planning for oxygen. That requires proper modeling and estimates based on the current modeling of the epidemiological curve in these countries, but also then assessing what sources of oxygen could be most readily made available in these countries, whether it's piped oxygen in the facilities that can take piped oxygen from liquid bulk storage, whether it's rapidly standing up or maintaining smaller plants, but still that can bring high-pressured oxygen in. They're called PSA plants, or shipping in oxygen concentrators, or making sure they're deployed to the parts of the country where it's anticipated the surges might be higher. That's so crucial now in the coming days and weeks for these countries. The same would apply, by the way, in countries surrounding Brazil, Peru, and thereabouts in Latin America, where there have been big COVID surges recently.
In the past few months, I guess this year, a lot of the focus has been on vaccinations. Do you think that what we're seeing happen in India might shift some of that focus to an issue like oxygen, and just how necessary it will be for the thousands of people that are contracting COVID now?
It's really important that these things are not seen as mutually exclusive, but all-encompassing. We need vaccination ramp up dramatically, but at the same time, it can't be at the expense of other interventions. Oxygen has been neglected. It's been neglected globally. It's been neglected in terms of financing. As an intervention measure in countries, in low-income, low-middle-income, and upper-middle-income countries, it's also not been prioritized sufficiently, at least in terms of planning and capacity. So it's really key, as is then the typical basic measures that you need for infection prevention, like personal protective equipment for your frontline healthcare workers, and masking and physical distancing and the like. So it's an all-encompassing, multifaceted approach, but it shouldn't take a tragedy like India at this scale to shake up the world into recognizing the critical need for oxygen as a medical therapeutic. I hope it does this time round, and we need to start moving quickly for other countries so we avert such a tragedy.
Robert Matiru, Director of Programs at Unitaid, a global health agency. Sir, thank you for sharing your expertise with us.
Thank you very much.